I am honored to be here. Thank you for sticking through the morning. I'll try and keep my talk perfectly timed, maybe a little early. And any questions I can't answer, I'll save and you can come find me if I don't answer it, if you have any questions. Okay, so our plan is first I'm going to poll the audience just in an informal way rather than giving you multiple choice questions. Oh, sorry. Rather than giving you multiple choice questions, we're just going to have some polls. I'll present a patient case, which is an actual case in our clinic, and then describe conventional approaches to managing vasculitis, but then segue into talking about integrative medicine and how this is becoming sort of the medicine of the future. And then with the patient in mind, we'll give some actionable items about things we can do from an integrative standpoint. And then I've left out some information given the time of the talk, so hopefully that will generate lots of great questions. So first of all, how many of you at least hate or at least dislike steroids? Like prednisone's your frenemy. Okay, me too. Me too. And how many of you are wanting more than conventional therapies? Me too. Okay. And how many of you have heard of integrative medicine prior to today? Okay. And then how many of you have tried unconventional or complementary and alternative medicine techniques? So a relatively good number. And then how many people here meditate every day? And by meditate, I don't mean playing Pokemon Go or watching reruns of Downton Abbey. It's more like going to a place and getting really silent. So not very many. Okay. And then how many of you, this was a similar question I think Dr. Chung asked, how many of you think that what you eat can influence disease severity? Wonderful. Okay, I'm done. You guys have this. Okay, so I thought I would start with a patient journey. So this is a 67-year-old gentleman, so he hasn't even entered middle age yet, and had a past medical history for high blood pressure. Back the day after Christmas, he was unable to complete sentences, noticed a lot of hoarseness, and also had debilitating joint pain. He went to an urgent care with shortness of breath and cough, and they did imaging which showed that he had a lot of opacities in his lung, and was given, as many people are, oral antibiotics that were started for what was thought to be an atypical pneumonia. His symptoms persisted, and then he was admitted to a hospital in the Greater Triangle area in North Carolina. He had bronchoscopy where they looked inside his lungs to see if they could figure out what was going on, and was ultimately discharged with antibiotics. He then heard about our clinic and made an appointment with our group, and during that visit was found to have lots of fatigue. He had a fever that would come and go, lots of coughing fits, a right maxillary sinus pressure, and then this daily tissue-like bloody discharge from his nose, and unfortunately also had diarrhea, lack of appetite, and significant weight loss. This is just a basic chest x-ray of his lungs, and you can see that the lungs have lots of white patchy infiltrates throughout the lungs. There are lots of reasons why someone could have this. And then ultimately he had a kidney biopsy which showed what's diagnostic, and this is what we call necrotizing and crescentic glomerulonephritis, which is a very fancy set of words which basically show here a filter of the kidney, or glomerulus, where blood is passed very quickly through the filter to generate urine. And with the condition that this gentleman had, he had lots of inflammation with inflammatory cells in this filter, which caused the filter to break down and result in kidney insufficiency and lots of blood and protein in his urine. So ultimately, we diagnosed him with granulomatosis with polyangiitis, or GPA. And I don't like to give away my age, but 25 years ago when I was 18, the pathogenesis of ANCA vasculitis was relatively unclear compared to what we know now. So for one of the conditions like this, which is very rare, for the ANCA vasculitides, we actually know a ton about it, and there have been tons of clinical trials which have been very helpful, and I'm just illustrating that here. But you can see that there's a lot to know and a lot that's been learned, and we're needing to learn less and less as time goes on. Now, in a traditional setting, this patient would be seen by a physician, the diagnosis would be made, and conventional techniques would be applied. And in the conventional medicine framework, I've depicted like this. So Dr. Chung talked about genetic predisposition and that there really aren't a lot of tests we can do right now that can give us help with diagnosis and management. And then with that, there are unknown triggers. Some are known, but mostly are unknown. So we call it an idiopathic disease for the most part, which basically means we just don't know what causes it. And in any type of autoimmune disease, including all the other small, medium, and large vessel vasculitides, these two things lead to autoimmunity. And unfortunately, in this day and age, this often means that we end up taking lots of oral, subcutaneous, and intravenous medications, which have lots of different known and unknown short and long-term side effects. But at the same time, we've developed highly specific biologic therapies for many of the vasculitides, but in GPA and MPA in particular, rituximab, as many of you probably know, is becoming so ubiquitous that some of us call it vitamin R. Unfortunately, though, even though we have relatively good treatments, this can sometimes, in many of you, lead to doom and gloom, because we can make people look good clinically on paper, but then they're left not feeling great in general when they come to see us in clinic. And so really, the conventional approach is just one piece of the puzzle. And as this room would suggest, all of us are different. We are different in size and shape, and each of us, even though we may have the same condition, that condition is different in each person who has it. So what is integrative medicine? It's a holistic approach to healthcare that encompasses the following influences affecting a person's health. And I've listed them here. So physical, emotional, mental, social, spiritual, and then environmental, as many of the prior speakers have alluded to. And through all of these things, there's also a combination of traditional and alternative approaches. So does anyone know what's special about today? Yeah, this was just before I was born. Neil Armstrong and Buzz Aldrin took their first steps on the moon July 20th, I think 1969. And like landing on the moon, integrative medicine is sort of a new frontier. So we have some evidence-based, strong data to support some of the integrative medicine techniques, but we're also implementing a lot of techniques that may not be proven in vasculitis, but could actually just be helpful for general health. And with regards to vasculitis and complementary and alternative medicine, this paper was published by Julie, who was up here a minute ago, and others at UNC, that showed that actually many people with ANCA vasculitis, at least in the southeastern United States, are doing a lot of complementary and alternative medicine in combination to the conventional treatment approaches, but they're actually not talking about it very much. So in this study, 81% of patients who were in the study incorporated CAM techniques, but only 24% discussed CAM with their doctor. Now, shifting to the integrative medicine framework, it's a little different from the conventional medicine one. It's important to optimize the immune system in good ways, to also assess lifestyle factors, look at epigenetics and genetics, environmental triggers, and how all of those in combination can lead to autoimmunity. And if we can make a difference in those things that lead to the autoimmune condition, then we can make the autoimmune disease better, and we can also reduce relapse and hopefully one day prevent people from actually developing the disease. So I tried to not touch at all on any of the other topics in the other talks, but I think it is important just to reinforce genetics and epigenetics. So we know that DNA is insulated through things that stick to it, like methyl groups, and that if we de-insulate that DNA, then the DNA is less protected and lots of bad things can happen. And we know so much about DNA methylation now in conventional medicine, which we apply to integrative medicine techniques, that if DNA isn't methylated in an appropriate way, we can actually predict who's in remission and who isn't, at least for ANCA vasculitis. So it's important to note that genetics loads the gun, but environment pulls the trigger. And I've sort of listed here in terms of environmental exposures, drugs and toxins. The drugs I'll talk about in more detail in the next slide, but silica has been mentioned. Concurrent undiagnosed infections that could be making the disease worse. Diet and how important modifying the diet can be for not only symptoms but disease severity. Lifestyle, so almost everyone who comes into our clinic complaining of something, it's highly likely that what they're suffering from is in part due to stress. Physical activity and sleep quality, and then location. So we've talked about what the winds can bring, but there are lots of things about where we live and what we do and what we put on and in our bodies that can make what's happening worse. So this is just a study I like to share with every talk I give, even if it's not related to vasculitis, which is looking at a large cohort of patients in the northeastern United States with drug-associated ANCA vasculitis. And you can see over time listed here, see if you can see my pointer. No, really. Oh, let me try this. I'll just point over here. Maybe not. Never mind. So hydralazine, propylthiouracil, or PTU, cocaine, especially cocaine that's adulterated with levamisole, which is a horse dewormer, and then minocycline. These are all drugs that have been associated with ANCA vasculitis. And you can see that over time, looking at these heat maps, the more intense the red color, the more cases there are. And if you go down and look by year, you can see for hydralazine in particular, you know, this is a drug that we find a very strong association with the disease. So hydralazine, there's a definite link. And the more it's been prescribed over time, the more cases we see. The other thing that's important to note with regards to diet is what you put in your body, I think, really matters, and it makes intuitive sense that if you eat poorly, that can make you feel poorly no matter what. So Burger King a couple years ago started making Cheetos chicken fries, which are ground up pieces of chicken formed into sticks that are then deep fried in a Cheeto batter. And while these may taste good, I think it's, you know, all of us can agree that if we're eating Cheetos chicken fries for lunch every day, regardless of whether or not we have vasculitis, we probably just aren't going to feel as good. And despite, you know, how much we engage in physical activity to try and improve our wellness, if we're not doing things from a dietary standpoint to improve our wellness, then it doesn't really matter how much physical activity we're engaged in. And I only show this picture just to prove that point. So you can see on the right is Five Guys. Do you guys know what that is? Which is like this really great burger place, but not very good from a dietary standpoint. And then on the left is Orange Theory Fitness, which is a high-intensity interval training group that's kind of across the world now where people can go and work out. So, you know, if you go work out at Orange Theory Fitness and then eat at Five Guys, that's sort of counterintuitive. It's a little hard to see in the picture, but the store in the middle has a big for lease sign, which is, I think, where we should have another integrative medical clinic, just to help with education. And just to drive that home even further, I did fellowship in Boston, and this is right where you cross the finish line for the Boston Marathon, and you can see that there's a candy shop right next to a dental clinic, which sort of just kind of solidifying that point. And then if we're not doing good things for our gut, then we can get what is called leaky gut. And this is a new and emerging concept in integrative medicine. Again, there's not very, very strong data in vasculitis for leaky gut, but there are a lot of papers and research projects that are being done as we speak, looking at leaky gut and its association with lots of different autoimmune diseases. And I'm sure Dr. Ree could probably explain this much better than I could, but leaky gut is a problem, and if we're not putting good things in our GI tract, then that can cause more inflammation in the GI tract, and I think our GI tract is one of our biggest immune organs, and if there's leakage of bad stuff through our GI tract into our bloodstream, then that can lead to all sorts of bad things, like food intolerances, and then potential for autoimmunity. Some of you touched earlier on Epstein-Barr virus and autoimmunity. So in addition to diet and toxins, it's also important to think about infections. And Epstein-Barr virus is a very popular area of research right now, in that people who mount a very strong immune response to Epstein-Barr virus have a stronger association with the development of autoimmune disease. And this proves the point. So rather than get into the details, this is in a very high-profile journal looking at DNA from lots of different people with different autoimmune conditions. Vasculitis wasn't included, but more heavy hitters in terms of prevalence of diseases were included. So multiple sclerosis, rheumatoid arthritis, inflammatory bowel disease, type 1 diabetes, to name a few. Patients with those autoimmune conditions compared to healthy matched controls were more likely to have what looked like incorporation of Epstein-Barr virus genes in their DNA that was then resulting in transcription and translation of proteins that were more pro-inflammatory and more likely to cause autoimmune disease. So it's becoming more and more clear that there may be a link between making our immune system not as fit and not as efficient if we've had prior exposure to Epstein-Barr virus and are still kind of mounting a strong immune response to that infection. And I'm getting close, just to let you guys know. So what do we do to feel like these people? All these people look healthy. They've done well. What do we do? Part of what we do, in our clinic at least, is to really look at the integrative medicine wheel. So rather than thinking primarily about which FDA-approved medications are most beneficial for treatment, while they're extremely important and necessary, there are lots of other things we can do to sort of complement the effects of those treatments that can make people not only look good on paper clinically, but also feel good when they're out and about in Minneapolis during this symposium. So the broad integrative medicine approach I've sort of listed here as key points. And then the next slide, I'll talk about our patient and some of the things that we did that I think sort of illustrate integrative medicine as compared to what happens in a conventional medical practice. So first, we reduce inflammation in a targeted way, as we would, because we are board-certified internists and nephrologists. We minimize steroids if possible. We use targeted biologics that have a low side effect profile. And then we tune up all of the other medical comorbidities. So If someone has hypothyroidism, we really work on managing that to help them feel better. If they have anxiety and depression, then we really spend a lot of time working on ways to improve anxiety and depression because those are very common in these conditions. We then identify and eliminate vasculitis triggers. So I'm crazy about drug culprits that cause vasculitis and always look for them. So we stop any and all drug culprits if they're known, and we do that forever. So I have an interesting case when I was early in my adult career, where a patient came to see me who was on dialysis that had gone into renal failure for untreated ANCA vasculitis and was in remission but started coughing up blood. And when we talked, it turned out that he had been started by his primary care doctor on hydralazine a year prior. And so he had an idiopathic form of disease that then became drug-associated and caused different signs and symptoms. So it's important to really know what the drug culprits are and to make sure that they're stopped and that they're never restarted. Or if they have the condition that drugs that can make the disease come about are never used. We then also think about dietary sensitivities, and this can be done in lots of ways, and then we limit those exposures. So Brent Sr., I hope, will agree with me, but if people have upper airway disease, it's very common that dairy consumption can make the upper airways more congested. He's nodding, which is good. And if we eliminate dairy in that situation, then it's much less likely to have as much congestion. So we work on things like that, either through elimination of certain food groups or through specific testing to see if people have sensitivities to things they never knew. We then identify and eliminate ongoing infections if they exist, and many of those have been discussed already today. We work strongly to heal the gut so that we can prevent that breakage of the barrier. And then we modify lifestyle factors, so we work on stress reduction, which Julie McGregor will talk a lot about in the mindfulness breakout group, and then also on diet, which she'll also discuss tomorrow in the main group. And then we focus on maximizing good sleep and promoting physical fitness. So for this patient who hasn't reached middle age yet, we went through the following things. So he had a diagnosis of GPA. We had found that he was on hydralazine, so we stopped that, which he had been taking for blood pressure, and switched to alternative agents. He also got what is considered conventional good treatment for what he had. He also, despite all of that, was having additional diffuse joint pain, and so also had some medical comorbidities. So in an integrative way, we added some supplements that we think are helpful, which I think, in part will be touched on. So we added curcumin with black pepper extract, which increases its potency, fish oil, cherries, and even CBD oil. All of these things helped him quite a bit. And then we micromanaged his medical comorbidities with blood pressure and hypothyroidism. In terms of ongoing infections, he didn't have any bacterial infections. There were no fungal infections that we could find, or parasites, given that he didn't have any risk factors for parasite carriage. But he was HBV positive and also had a strong immune response to EBV. So we focused on treating those as well. And then in terms of gut healing, I do think what we do with our diet is very important in terms of improving how we feel. And so the autoimmune protocol diet is a relatively intense diet if you Google it, but it's really more important to think about what you can eat rather than what you have to eliminate. And if you Google that, you'll see. But the idea is to eat things like Dr. Chung recommended in part. So healthy, good fruits and vegetables, and then protein that's from good sources. And then basically getting rid of everything else. So that would mean like no sugar, no gluten, no dairy. And that helped him quite a bit. And then in terms of stress, sleep, and physical activity, He started weekly therapy, and I think, really, in reality, everyone over the age of 5 probably needs a good therapist to touch base with once in a while. And he also started daily meditation, acupuncture. Reiki I haven't touched on, but is an interesting energetic healing modality that I think some people find benefit with, even though we don't have a lot of clinical trial data related to it. And then, have you guys heard of Silver Sneakers? Yeah, I thought so. So he also started Silver Sneakers, which, I think is another good physical activity program once people are feeling up to it. So my big key takeaway is that integrative medicine is a new and emerging option for combining conventional vasculitis treatments with additional healing techniques to achieve overall long-term wellness. And with that, I will take any questions. Wonderful question. If for those of you who didn't hear it, it was, should we check with our physician before we engage in some of these alternative healing practices? And I think it's always important to touch base with your physician, but I'm sort of guilty because I'm a physician and I like it when my patients tell me what they're doing. But I think it is good. So there are lots of ways that some of these things could potentially be harmful, and it's always good to just touch base with someone who has experience. And, you can always run it past me if you want. But often we really need to know you in great detail before we can make a decision. But, yeah, I think it's important to touch base. The question was, can you further explain DNA methylation and why is it important? Yes, great question. I think Dr. Chung would do a much better job, but I actually am very passionate about how DNA can be changed to make people feel good and bad. Interestingly, hydralazine is a drug that can make people methylate their DNA less and make them more likely to develop autoimmune disease. But I think the simple way to think about it is kind of what I mentioned before, which is if our DNA is well insulated, sort of like if we live in Minneapolis in February, which I wouldn't wish on very many people, sorry, Minnesotans, but if we wear a big jacket, that's very protective because it can keep us warm, and the same happens with DNA. So if our DNA is well methylated, then it's less likely to be hijacked, and that's super important. So we want to keep our DNA well protected. Next, but it said, is integrative medicine covered by traditional medical disability insurance? Sort of depends on the practice. Our practice in particular, not that I'm advertising, but we feel like it's very important for integrative medicine to be something that people of all walks of life can have access to. So our clinic takes all forms of insurance, and there are lots of clinics like that around the country. It sort of depends on who's running the clinic and what the insurance companies decide. And some of you may have even noticed that things like acupuncture are covered by some insurance plans, so it's definitely a possibility. What is the best advisor to recommend physical exercises in types with vasculitis conditions? I think that's something that would be good just to touch base with your treatment provider and then see what they have to say and go from there. And I think the Vasculitis Foundation is probably another wonderful resource just to touch base with people within the foundation to see what experiences other people have had. So I'm going to stop there because I've hit my time limit, and feel free to find me.